Hi, my name is Angel Rivero and I am with another angel, Dr. Angela Aguilar. Thank you po for guesting.
Hi, Angel.
And we have so many questions about fertility. And the first one being, what do you find, Doc, to be the most common problem that couples encounter when they are trying to conceive?
The most common problem usually is that they don't know how babies are made. Interestingly. So there needs to be a lot of education to tell them how they actually are able to conceive. Apparently, our educational system is not so strong in sex education, so there are a lot of misconceptions, and because of that, they have all sorts of mythology about trying to help themselves.
That's right.
So they don't know about the egg and the sperm for a lot of people, or they have other concepts that are not really of scientific basis. So that's why, because of that, they rely on all sorts of stories, things that they pick up online, things that their barkada says.
Yes.
And we have to educate them and correct them.
That's right. I know it sounds rather ridiculous, but it's true nga, Doc, no? Na
Yes.
parang not everyone is properly informed.
Correct.
And maybe not everyone knows na there is only a specific time during the month
Yes.
that the woman is actually ovulating.
Yes.
So number one is the education.
Yes.
So say for example, wala nga silang alam, no? So should they seek this information from their doctor na kagad? Or do you suggest maybe they can read up on it? Internet, baka hindi reliable internet.
That's right. On a large scale, we really have to improve our educational system. Even as young as, grade school or high school, the basics should be introduced in a proper
Agree.
manner. So regardless of what you want to do with your fertility and how to properly time your pregnancies, whether you want it or you don't,
Yes,
you know what I mean?
precisely.
Then we have to be educated about that. So we're able to get the outcome that we want. Okay, so when you're adolescent, of course you want to avoid
Of course,
it.
you don't want, di ba?
But when you're of marrying age or already as a couple, then you really want to conceive and start a family, then you should be able to handle it because you're properly informed. And your lifestyle and your habits are all towards the support of starting a family.
Yes, yes. Magandang angulo nga niyan, Doc, no? So say for example, they go past the educational part. So they understand how babies are made and they have tried. But so far, it's not working. So what goes on next?
Well, what goes on next is if in a year's time, after a reasonable period of trying, that is how we define it, they haven't been successful yet, then they can come in for a regular evaluation so that they'll be assessed as regards which of the major factors that will hamper their fertility will be present. For example, for the female, if they're regularly ovulating. For the male, it goes both ways, Do they have enough sperm of good quality to be able to cause a pregnancy? So those are the two major things that we have to evaluate. And of course, the bridge, which is the fallopian tubes, that can also be evaluated as well. So that can be done in one sitting, for example, or just in 1 week, that can be evaluated. If the woman is ovulating, history will help us assess whether you have true ovulation or not. Otherwise, you have to properly time the ultrasound to see whether the follicle or the egg is being produced and is growing properly.
You mentioned true ovulation. So meron pong false ovulation.
Sometimes women have regular periods, what they perceive as regular periods, but they may not actually be having regular periods. They just have some amount of periodic bleeding and they think that it is a sign that they're regularly ovulating. But when we do ovulation tests, for example, ultrasound, or urinary luteinizing hormone test, then it shows up that they're negative. And that means that the egg is not maturing and they're not putting out an egg at least every month.
And these tests, Doc, can be performed anytime during the month, anytime during the cycle.
Well, usually we evaluate the length of the cycle, and midway through that regular cycle, we time these tests. So an ultrasound will be done at about between day 10 to 14 in a regular 28-day cycle. And it can be assisted by a urinary luteinizing hormone test. In other countries, they will do a progesterone test, which is a blood test. But that has been recently been supplanted by less invasive tests because nobody wants a blood extraction anyway. You know what I mean, right? Yeah.
But isn't that more accurate if it's from the blood talaga?
Yes. However, if you see high progesterone in the blood, that's the hormone produced after ovulation, the only value it will give you is that it will tell you that you may have ovulated, but it has no value in terms of prediction. So the nice part about ultrasound or your urinary luteinizing hormone test is that it will help you predict, and after that you can properly time your intercourse so that you have a reasonable chance of getting pregnant
I
for that
see.
cycle.
Therefore, Doc, if not for the laboratory or the ultrasound tests, there are no physical symptoms that will tell you na, ay, siguro I'm not ovulating.
Well, before we have the symptothermal method. That means you have a rise in body temperature. We call it the basal body temperature. You have a change in the mucus. So your mucus will be from thick and pasty to clear and stringy. So those are the possible signs of ovulation. However, many factors may make it obscure. And for example, if you have fever, if you're under the weather, that rise in basal body temperature may not be accurate. If you have an infection in the pelvis, then your mucus will not be as accurate as it to indicate ovulation. So that's another story. And right now, to predict ovulation, we rarely rely on these tests anymore because it has a high margin of error.
I see.
Yeah.
Wow, it is a very complex universe pala,
Yes.
no? That's why it's very important to get professional medical
That's
help.
right.
That's right. Now, usually the stigma is that if it's infertility, parang they always look at the woman, but it's not always the woman.
Yes.
It can be the man, and it's quite easy to find out if it's the man, right?
Yes, all they have to do is submit a specimen. After 2 days of abstinence, and the lab will tell them whether they have or have not any sperm on them.
If hindi po sila nag-abstain, inaccurate yung magiging result.
Well, not likely, but the best way is that so that they don't have any excuse, just abstain for at least two days.
See, para
So that's the
madali na.
usual. Yes, yes. Although we have tests showing that even if a man ejaculates every day, and there was a study on that, 365 days, can you imagine the volunteer?
Ang saya niya.
Yes, and there was no significant fluctuation in a man who supposedly has normal sperm.
Solid.
Solid.
Oh my God. But so, since it's so malakas in that sense, what
Yes.
usually, Doc, are the causes of infertility then?
For females, ovulation comprises about a third. Ovulation problems comprise about a third of women who will have difficulty conceiving, and then a fifth will be the tubes. So there may be problems with the tubes of the woman, and then others are many other factors as well, hormonal or immunologic or other endocrine pathology that hampers all of these factors. For the males, then definitely the quality of sperm plays an important role. There is also a small fraction of males who may not be able to get a woman pregnant because they have sexual dysfunction, and that is a reality for many. And
Interesting.
sexual dysfunction may be either psychological or really organic. For example, men with diabetes, then they may have vascular problems or blood supply in the penis, so that they cannot get an erection. There are other males who may have functional erectile dysfunction. That means maybe stress, maybe alcohol, or maybe recreational drugs, or sometimes just plain stage fright can work against their favor, and they will not have an erection. And then for some, they have ejaculatory problems as well. There's such a thing as a retrograde ejaculation, where the sperm does not go forward, but rather when they ejaculate, the sperm goes to the urine in the bladder. So that to help these men, we do a post-ejaculation urination, and we get the sperm from the urine and use that for fertilization.
Oh no.
Yes, very complex but very interesting. So
Yes,
there are
yes,
many ways
indeed.
that we can help.
So, ibig sabihin, Doc, the approach to solving the problem here is not actually in curing the erectile dysfunction, but kumbaga to extract na lang the sperm and put it in the wife.
Yes, but depends on the nature of the erectile dysfunction, for example. So there are many men who would want to find out whether there is still something that can be done. Remember, if you have erectile dysfunction, there also could be relationship problems as well. So
Yes.
sometimes when we counsel couples and they are they're up for already well, say, comfortable with telling you and disclosing to you that these are their issues, sometimes you have to ask them, what is important for you? Is it important that you get a child regardless? Or is it important that we solve your issues as a couple together? For some, they would say, can you just help us through these issues? That may take a long time and it may be very complex. For others, they just want expediency. Let's get it over with. We just want a child, and then we'll solve our issues together in private. So
Okay.
that's something that we really have to sit down with the couple and check what their goals are, so we can focus our intervention towards that.
Ang galing! Kasi ang dami palang aspects, no?
Yes.
Beyond the physiological.
Yes.
It can also be parang a result of a relationship problem,
Yes.
psychology.
Yes.
Ang galing, Doc.
So it really needs a very good evaluation, and the doctor has to be very discerning in terms of finding out what is really the underlying cause of the fertility problem. For example, I had a couple. Well, the woman came in and she had, she said she has ovulation problems. So we just gave her ovulatory medication. So she was ovulating. I was monitoring her. And then after 3 months, nothing was happening. And I was saying, and then, what is happening? Are you having regular intercourse? And then she disclosed, Doc, I will tell you after 3 months, nothing happened. What do you mean nothing happened?
What
We
did
didn't
she
have
expect?
Exactly.
Yeah.
We didn't have intercourse. You have the egg. The sperm's not gonna miraculously go there. You really have
Yeah.
to have intercourse. So really, you have to be very discerning in terms of what is really the underlying cause. And sometimes it takes a long time for you to build a relationship with a couple so that they'll be able to come up clean with whatever is bothering them.
Yes, I think that's very important. Therefore, Doc, do you have any advice on how couples can find themselves a doctor? I mean, I know you can't really tell who you will be comfortable with, but I mean, do we have centers like by the government or a place where they can go and try?
Well, we really have centers that are in major hospitals that will help them. So there are many centers that will have multidisciplinary teams. For example, in a center where I practice, we also have psychologists. We also have urologists sometimes, not just gynecologists who specialize in fertility, because sometimes the males will not be comfortable with seeing the gynecologist. Sometimes
Yes.
they would rather see their own doctor, so to
Yeah.
speak. Says, can you give me my own doctor? Sure, we'll give you your own doctor. So urologists will help us. And then we also have people who would want to have some complementary medicine to help them. In our center, we also have acupuncturists that may help enhance the results of our fertility interventions.
So it may also,
It may
that's
also
great.
help, anything that will help. And of course, nutritionists that will be able to counsel them, because some are in poor health, interestingly. And the poor health is not even related to their socioeconomic status. Some people, they may have all the money in the world, but their food choices, their lifestyle is not optimum, and they really have to be assessed and evaluated and intervention be done so that they have their health restored. So I have many patients who are like that. Some even went through already full procedures such as IVF. So sometimes I take them back and says, can we check your lifestyle again? Can we see if you're okay? Can we check your blood sugar? Stuff like that. And then sometimes, as soon as I restore their health, get their lifestyle in a better place, then they conceive spontaneously.
Oh, wow.
Isn't that great?
That's wonderful.
Yes. And they have a bonus. They're healthier.
Yes.
And when they get pregnant, it's not just that they're pregnant in a healthy manner. Because sometimes
Fantastic.
the outcome will be dependent on whether they're healthy or not. You may get them pregnant, but they may miscarry, or they may have preterm labor because they're in poor health.
Oh, that's very interesting, Doc, no? Na parang that is not the end, the end goal, na to get pregnant.
Exactly.
Kasi baka naman pangit yung pregnancy nila.
Yes.
And then maging premature,
Yes.
or may mga complications.
That's correct. Above all, what we want is a family and not just a positive pregnancy test. And our main outcome measure is live birth. So we want them to have a to be very successful, to have a one live child that they can take home. Some centers would call it their take-home baby rate, so to speak. So it's not just exactly. It's like take out.
Yeah. One baby, please.
Yeah, one
I wanna
baby
take this home.
with fries on the side.
With fries on the side.
Healthy fries. So that's how it
Wow.
is. So we really want them to have a family, and that's the end goal that we want to achieve for them.
Beautiful. It's like a team effort of
Yes.
different specializations,
Correct.
and the participation of the patient to actually want to be healthy,
Yes.
and to have a family.
That's right.
Wow. Very nice talk,
Yes.
Doc.
Yeah.
I'm glad we did this.
Thanks. Okay.